I'm Dr. Rachel Beaupre, and I'd like to thank the ACC for the opportunity to present the effective education on improved use of sodium glucose transporter 2 inhibitors in veterans with heart failure. The objectives of the study were to define the initial status of use of SGLT2Is in VA patients diagnosed with HFrEF without any contraindications for use, to provide educational intervention in the Detroit VA system, to evaluate practice patterns and the use of SGLT2Is in patients with HFrEF at both 3 and 9-month post-intervention intervals, and to compare the Detroit VA MC practice with other veteran medical centers in the Veteran Integrated Services networks. Nearly 5 million Americans are living with congestive heart failure, and it is the leading diagnosis in hospitalized Medicare patients. It is one of the most common causes for hospital readmissions. Healthcare costs for treatment of this diagnosis alone are projected to be $53 billion in 2030. As of February 2021, the ACC guidelines issued a Class 1 indication for the use of SGLT2Is in patients with symptomatic HFrEF and an eGFR greater than 35. Empagliflozin is on formulary at the Detroit VA Medical Center, and thus the VA is in a unique position to maximize the initiation of SGLT2Is in appropriately selected patients and improve healthcare outcomes on a great scale. Retrospective and prospective chart review of the use of empagliflozin in all VA Medical Center heart failure patients with reduced ejection fractions were performed. Intervention was then provided in the form of lectures and grand rounds to cardiology and primary care providers over a 6-month period. Both 3-month and 9-month post-intervention practice patterns were then reevaluated. 198 patients total were chart reviewed, and the majority of these were male. All patients were adults greater than 18 years old with a current diagnosis of HFrEF based on echocardiographic evidence of an EF of less than 40%. Nearly 93% of patients were NYHA class 2 to 4 and thus met initial criteria for the use of SGLT2Is. The majority of patients were non-diabetic. Patients were also screened for any contraindications to empagliflozin. Prior to intervention, only 16 out of 198 patients were on SGLT2I therapy. 3 months following the specified interventions, there was an upward trend to 10.1%, and an even further upward trend to 18% of patients on SGLT2I therapy at 9 months post-intervention. This trend was concordant with most of the other VA medical centers in the same VISN, as well as the VA at large. The chart on the left demonstrates the practice patterns at the Detroit VA MC. As you can see, patients were at 8% of patients were on EMPA at the beginning of our interventions, and this increased to 18% at 9 months post-intervention. On the chart on the right, you can see that the VA MC in Detroit trend was in line with the rest of the VA systems within the network, the local regional network, and for the VA at large. Educational intervention in the Detroit VA system was highly effective to increase appropriate use of SGLT2Is. This was demonstrated by the 125% increase in SGLT-I use over 9 months. Prescribing patterns of the Detroit VAMC were not significantly different from that of other facilities in its same VISN or from the national VA average. We believe that the overall lower rate of utilization may be due to hesitancy to use the drug in non-diabetic patients. Ongoing efforts with repetitive aggressive education and implementation of a QI metric will help further increase adherence to guideline-directed therapy and the use of SGLT2Is, and we hope to demonstrate a decrease in rehospitalizations in this patient population. Thank you.